Welcome to Module 3. Take a deep breath, let it out. You are at the halfway point. So, again, you have this. So, let's talk about Module 3. And as we're addressing Module 3, we're going to be talking about some really interesting topics. One of the topics is nursing in a culture of violence. As you can see, we have various PowerPoints here. Professor Beth Campbell, who has a background in forensic nursing, developed these PowerPoints. And I think her perspective is extremely valuable because of her experiences. When I think about violence, I think that as nurses, we have a two-tier exposure to this. One is we care for patients who are victims of violence, have may suffered violence in their past, and we may see some of those issues coming forward in their coping abilities, in how they're dealing with stress. Or we may be caring for patients who had just suffered a violent attack then, and how do we address that? How do we take care of them physiologically, but also their mental well-being, and providing that safe environment for them. I've had various experiences of dealing with patients of trauma, and especially when I used to work nights, with a lot of PTSD coming forward, and like night terrors, and trying to really help them feel safe. And it's exhausting, physically and mentally, for nurses to care for patients like this, because it can trigger us, and it also, it's so heartbreaking. The other flip side is also we can be victims of violence. Is we've seen more and more reports of violence happening in healthcare settings, and I honestly don't know if it's happening more or if we're just more reporting of it and we're hearing it more with social media and other aspects. But one of the things that is changing is how do we deal with patients who attack healthcare workers. There is a large movement that is looking at possibly criminally charging these patients, and there's also this mentality that getting beat up was part of the job, and now that's not as acceptable as anymore. And I think people have some mixed feelings about these things, and so it'd be really interesting to see what your feelings are. And then the other issue with violence, and I'm sorry, I should have said 3 pieces of it, is we're mandated reporters. So in addition to violence, there's also abuse and neglect. And what is the role of the nurse? And as a mandated reporter, how do we report that? How do we address these issues to make sure that we're keeping our patients and our community safe? And again, that it seems so easy and very like, yeah, I just report if I see someone getting abused, but there's a lot of layers there, and there's a lot of issues that kind of come through in looking at that. So hopefully this will kind of really get you thinking about that and having some thoughts and feelings, and I'm really interested in seeing what you guys post about some of this stuff. The other piece of it is nursing theorists. Now, I know a lot of people are like, oh, that's not as exciting. Nursing theorist to me is really the foundations of the profession and how we've moved forward. So we talk about theorists in general, and then we also give an example of Patricia Benner, who really looked at, who's active nowadays. She's still very much involved in, and her stuff is moving forward and looking at nursing as theorist, and also looking at how nurses have a philosophy and how that is built out on how we care for our patients, and also our practice. So looking at the various theorist things. So we have a couple of assignments due for this module. Again, for this one, we have our first one is the Born discussion post. Now this is going to have a post that's due on a Wednesday in the peer response. One peer response is due on the Saturday, and the same as the current discussion post and the peer post. Now the Board of Nursing, this is in Massachusetts, they regulate our practice. So we have to be safe practitioners, and that comes through the board. Now, if there's a question of a nurse not being safe, maybe they're not giving meds safe, maybe they're coming to work intoxicated, maybe they're causing harm because they're doing unsafe actions, or they may be abusing their patients. We want you to understand that as having a license is not a guarantee. This is something that you've earned, but you have to continue to earn it and maintain it. In that, if you're not safe in practice, the public has the right to report you, and the board can investigate. And that's the job of the board, is to keep the public safe. And so they can investigate you to see if you're not safe and take away the privilege of having a license. So this is the whole piece about what's the process of that if a complaint is filed, and also talking about how nurses can lose their license. So this is kind of a post. So look over the discussion board, look at the rubric, go through that, and then you should do a post and a peer response. Remember, you want to cite your sources in both of these. The second discussion board post is the current news discussion board. So we're definitely seeing a lot of things coming through with current events. The big one with the Vanderbilt case. And then there was a couple other cases that have come through this past summer. The correction officer, and then there was another one with a long-term care facility where a patient injury or death occurred. And what ended up happening is that these states criminally prosecuted the nurses. Now, the Vanderbilt one has already been resolved. The other two cases are actually going on currently right now. And we really want you to kind of look into that. And again, remembering that having a license is a privilege, and you can lose your license. But if there is harm happening to the patient, intentionally or unintentionally, that might be two different things, should nurses be criminally prosecuted? And what does that mean for the profession as total in nursing and in healthcare? So you really want to get some of your feedback on that. So you do have an initial post and a response post. And again, make sure you're using your site, your resources, and you're citing them. And then the last one is your seminar. This is your big presentation on a theorist. So hopefully you've been looking at your various theorists, you signed up for a theorist, and you're going to look at this rubric here. And what we'd like you to do is do a presentation on a theorist. Now, this presentation is going to be, you could do different formats, you could do PowerPoint, whatever you'd like to do, but it does have a voiceover piece of it. Some people will do Zoom links, various ways that you can do this, whatever you'd like to do. And you're going to talk about the history of the theorist, and here are the various theorists that are signed up. And what we want you to do is do an introduction about the theorist. And then we want you to answer the various questions up here. Who was this theorist? What was their time frame? Put that in perspective. Think about Florence Nightingale. Like, at her time frame, she was like so innovative in thinking about in the role of a woman at that time and what she was doing. Describe the current theory. And the most important part is, how does that be seen now? And we want you to look at the current nursing practice and apply that theory, and where is the strengths and where are the weaknesses in those pieces of it. And then after you do that, you're going to post it, and then you need to respond to a peer's post. And again, you need to be using your resources. This is the bigger project that you're going to be finishing up there. Once you're done with those, you're just going to post them here. So again, deep breath, you have this, and please reach out with any questions. Thank you.